1 in 10 babies worldwide is born prematurely. The sickest and the most premature of those babies spend an average of 44 days in neonatal care, and 40% of that time is actually spent in intensive care, where they may be exposed to an estimated average of 10 painful procedures per day, so it's actually very frequent. Now, all this is happening at a time when the brain is developing rapidly, and the nervous system, which is responsible for encoding pain, is actually changing quite rapidly. Experience of pain in this early time actually has very long-term consequences, for example, impacting pain processing in later life. We need to be able to handle pain at the time it's occurring in order to minimize the discomfort. The brain activity related to a stimulus which is damaging the tissue and it's perceived as painful in an adult is very different between neonates and adults. What I wanted to do with the Emerging Leader Award was to back translate that observation in an animal model in order to understand what are the changes in the brain circuitry. Stefan and I have been friends for quite a long time. We've been planning to collaborate for many years. Stephanie is an expert in animal model of system development, and I'm an expert in brain development and electrophysiological signal processing. So by combining our two expertise, we were able to translate what I observe in humans into animal model. Our research could influence management of pain in neonates by providing objective way of measuring pain processing that you can use in order to test the efficacy of analgesic treatment. Using brain dynamics, so the brain activity, we can devise non-pharmacological strategies to manage pain. The impact on patients is quite direct because that would lead to more compassionate and targeted treatment, improving the experience in neonatal care. The Medical Research Foundation decided to prioritize this research area because I think it's a very forward-looking investment that will have an impact in the long term to the healthcare system, society as a whole, as well as for the individuals and their families.